So this is a little bit of an overview slide, and I'm not focusing primarily on the hard frame today. That's a whole day of the thorax class, but we got to get a little framework to it. So of course we're going to have the manubrium. You're going to see the manubrium at the top of your sternum, connects to the body of the sternum, and then on the sternum, of course, you have the xiphoid process at the bottom, and where the manubrium goes into the body of the sternum, that's the sternal angle there. Okay, so that'll become important later on. Of course, we're going to have we're going to look at this in a little moment. We're going to have the sternum in relationship to the clavicle that you don't see here, but you do see it is connected to ribs. And as we go through these ribs, we'll talk about them a little bit later on, but notice sternum. On the ribs, there's a cartilaginous aspect to it. And as you go down, that cartilaginous aspect gets a little wider. And as you go down towards the 7th rib here, you're going to see these cartilaginous 7th rib, 6, 7, 8, 9, okay, 10, yeah. So you're going to see that you have cartilage here, okay, and then you're going to have the rib itself, okay, the true ribs, okay. So that becomes important. We'll talk about that a little bit later on. Over here, we're going to look a little bit at the sternoclavicular joint and area, because we're going to go into this area in a little detail. And so again, oops, hope that doesn't happen. All right. So we have the manubrium over here, and then the manubrium, it does relate, as we were saying, to the rib through that cartilaginous area. And if you go a little bit above that, you can see that that's the medial aspect of your clavicle. Your clavicle to your sternum, your sternoclavicular joint, does have a disc, and over that disc you do have a ligament. Okay, so there's a clavicular ligament here, and that sternoclavicular ligament we'll go into in detail in the class. There's not only an anterior sternoclavicular ligament that you see here, but actually there's one posteriorly, which you can't see because it's a front view. And so if somebody, you could imagine, has some fall on their arm, or some maybe sports injury or trauma that had happened that affected through the clavicle, and the force is coming in into the sternum. And so you may have some problem at the sternoclavicular joint here and ligament. There is an interclavicular ligament that connects both sides. So of course, you might have the problem that they fell on the right side, but they're complaining about their left shoulder because it's adversely affected onto the left sternoclavicular joint. So of course, everything's connected. And since we have a little bit of a close-up here, you get a really nice shot here. You could see between on the first rib, on the cartilage of the first rib, and the beginning, the medial aspect of the first rib, there's a rib, a costoclavicular ligament. It's between the first rib, clavicular, I said it right. There's a connection between the first rib. It goes superior laterally, kind of on a diagonal, because we treat along the fibers many times. And so this little ligament also could present little problems before we get underneath it, as we're going now. And so this is important to be aware of. This, if we went further out, and I didn't see a good picture in one picture, so I broke it into two. If we go on the clavicle and you go out to the side, of course, you're going to come to the acromion, and then you're going to be at the shoulder joint, the glenohumeral joint itself. But what I want to point out here in a little detail are a few things that'll come up. There's connections between all this. So if we have issues that happen at the mediastinum, at the sternum, at the neck and such for now, it could reflect through the tissues that go more laterally, as you're going to see the subclavius, and then you're going to see as we go lateral there, you have a coracoid process. So that's like an anterior projection from the scapula. And connected to that are two ligaments here, a carinoid, it's the more medial one, and a trapezoid ligament, or the coracoclavicular ligaments. And you're going to see when we do the subclavius, we're going to be referencing this. And you're going to see also medially just to that coracoid process, you're going to have a scapular notch. I don't think it's labeled here, but you have a little notch in here that's going to be the insertion point for one of the mid-cervical fascias, the omihyoid muscle is going to go here. So we're going to talk about that in a few minutes.